The treatment of functional neurological symptoms is difficult, and it's fair to say that we are only in the infancy of understanding how best to treat them, and that's despite the fact that we've known about these symptoms for over 100 years now. What we do know about treating it is based heavily on the treatment of the commonest disorder, which is chronic fatigue. There's a syndrome known as chronic fatigue syndrome, sometimes known as CFS-ME, and a substantial proportion of the patients with that condition probably have a functional neurological disorder. It's not possible to say that everyone does, and it's possible there may be other causes of chronic fatigue syndrome, but it is a common symptom complex in these patients with chronic functional neurological disorders. What we know about that condition is that it is responsive to three different modalities of treatment. The first is pacing. Now, pacing involves adjusting the amount of activity you do on a daily basis, limiting it by planning ahead in such a way that you can cope with the amount of activity you do on a daily basis, and you know you've got it right because you cease to have fluctuations in your condition. If you don't pace yourself, you'll wake up some mornings feeling terrible, and other mornings you'll feel relatively all right. If you do pace yourself, you'll find that gradually over a period of weeks things will become much more predictable, and you'll find that in the morning you'll wake up and you'll have the right amount of energy, maybe less than you're used to, less than you'd like, but it will be sufficient to get on with what you need to do on a day-to-day basis. Why does pacing work? Well, I think pacing replaces the normal emotional control of stress and activity. So most people who don't have a functional disorder will know that they've overdone it because they will feel stressed. People with a functional neurological disorder cease to feel that stress, and so there's no off switch. They will continue to push themselves hard until they exhaust themselves. So you need to replace that automatic control mechanism that people have with something that's planned in advance. Now that can be problematic because a lot of people find that the ability to pace is just sabotaged by day-to-day activities. If you're in a stressful situation, if you have family commitments, and things happen, of course, in all families which upset the ability to plan in advance, and that can be a real problem for people to pace themselves effectively. The second thing that can help is a graded activity program. Now, the problem with the graded activity programs is that they only work if the pacing is right. So they don't work if you haven't been able to pace yourself successfully. If you try to do a graded activity program, which basically is gradually pushing the envelope of the activity you do on a day-to-day basis until it's back to something more normal, if you do that without pacing, all you find is that you exhaust yourself, and the next day you end up in bed all day because you can't cope with the increased activity. It seems that you have to get the pacing right before you can do the graded activity program, but if you do get the pacing right for a few weeks, then you find that you can plan to increase the level of activity on a week-to-week basis and get back to a much more normal level. The third thing you can do, which is frequently helpful, is psychotherapy. Now, a lot of people find the idea of psychotherapy a bit odd. You've got very physical symptoms. Why on earth would psychotherapy help? And indeed, what is psychotherapy? A lot of people confuse psychotherapy with psychiatry. And we know that psychiatrists are doctors and they give out drugs and they give people advice in clinics, but psychotherapy is rather different. Psychotherapy is talking therapy, and you have a group of skilled psychotherapists who are particularly good, particularly skilled at helping people with emotional problems. That is their speciality, that is their forte. So the idea is that this is an underlying emotional problem, and the correct group of professionals to see to help with that are the psychotherapists. So what do psychotherapists do? Well, I'm not a psychotherapist, so perhaps I'm not the best person to answer that. But in simplistic terms, psychotherapists help with the emotional disconnection. They help you understand why you should have emotional disconnection, so they help you understand the events in your life which have caused the emotional disconnection, and they also help you sometimes reconnect with those emotions. They help stabilize your emotional situation, and they help you with traumas that you've experienced in your life. Now, people often ask that's all very well for certain symptoms like chronic fatigue that I get, but what about the other physical symptoms I get, the difficulty with movement or these terrible pains I get? Are they likely to be helped? The answer is that they are helped by those same techniques that you use for chronic fatigue syndrome, but I think the psychotherapy also helps. It's not a quick fix, but with the psychotherapy, what tends to happen if it's successful is that the symptoms naturally evolve, but they tend to evolve into a milder and milder state, so that people find they become less disabled. Ultimately, the prognosis for functional neurological symptoms in most people is quite good. You rarely see such symptoms in elderly people. So they do tend to get better by themselves. The idea of the psychotherapy is that it hastens the improvement which would otherwise take a long time.